In today's lesson, I want to talk about research peptides versus pharmaceutical peptides. So peptides were discovered around 1901. They're small proteins. If a molecule has more than 50 amino acids, it's typically called a protein. If it has less than 50, it's a peptide. We began using peptides like insulin in 1921, and the evolution and use of peptides has been remarkable. All that to say that peptides are naturally occurring proteins that I personally consider safe to use, and they have profound benefits in weight loss, cognitive functioning, soft tissue healing, etc. Compounded medications are custom-made drugs that are mixed and prepared based on a doctor's prescription. That's it. They can be made from commercial drug products, bulk ingredients, or a combination of both. So essentially, if your doctor prescribes you 500 milligrams of acetaminophen, then you might be able to go to a regular pharmacy and pick that up. If he, for whatever reason, prescribes you 501 milligrams, which is kind of an off dose, then that would probably need to be compounded or custom made. That's all a compounding pharmacy is. Compounding pharmacies use pharmaceutical grade ingredients, and they must be registered with the FDA. They are intended for human consumption. So peptides fall within the scope of compounded medications. Compounding pharmacies are notorious for compounding peptides, and they often use the compounding process to circumvent any potential patent issues. For example, if there were a patent on HCG that prevented a pharmacy from making it, they'd be completely within their rights to compound it with something like B12 and call it something new, and that's a practice that they use often. Many of our well-known peptides are compounded today. The FDA has banned certain peptides, and the list is continuing to grow. So the ban, the FDA, along with the price, is cause for the research market. So what is a research peptide? Well, if a pharmaceutical grade is made by a pharmacy, quite simply, a research peptide is a peptide that would otherwise be compounded by a pharmacy, but it's manufactured elsewhere, and it's intended for research purposes only because it's not manufactured by a pharmacy that's registered with the FDA. Because they don't come from the pharmacy and they aren't intended for humans, the FDA has zero regulating authority over research peptides. This is why most research peptide companies refuse to provide you with any insight or assistance on dosing. I get asked every single day, what does for research purposes only mean? Well, what it doesn't mean is that they can't be just as or even more effective as pharmaceutical grade products. It doesn't mean that they're inherently impure or dangerous. You just need to do your due diligence. But we'll get into that in later lessons. Essentially, a research peptide is a product sold by a company, and they can't tell you how to use it. So they give you this vague for research only tag. Why? Why aren't research peptides for human consumption? Well, to be considered for human consumption, the FDA would have to regulate them. When the FDA tests medications for approval, they don't always test them in the way that they're intended to be used. For example, some peptides that have been banned by the FDA were tested at 4 milligrams taken intravenously when the common practice dosing is 0.25 milligrams taken subcutaneously. It doesn't make any sense. Why would we be testing and banning peptides that are being tested in a way that nobody's going to even use them? As the FDA pressures pharmacies to stop manufacturing certain products, research peptides fill those gaps. The research must continue, right? So because they're for research purposes only, they're also considerably more affordable. But you have to do your homework. You have to know where you're getting them. I'm a huge proponent of research chemicals, but it's necessary for you to know what you're getting, from whom you're getting it, and how to use it. And we'll get into what that looks like in our next lesson. Now that you've got a decent understanding of what a compounding pharmacy is and what a research purposes only peptide is, we'll get into how to use them in later lessons.